Georga Karakos, excuse me, is back again and will give now his talk on compression therapy after superficial venous treatment. A must, and for how long?
Good afternoon, and I apologize for the technical difficulties we're currently facing with the network. I thank the manager for helping me out with the proceeding of this presentation. Next slide, please. I have no disclosures. Next. So the thing with the documentation of the beneficial effects of the compression therapy after superficial vein thrombosis is not something new. It has been attempted to be addressed in the recent past. We see here the consensus paper by the International Union of Angiology 4 years ago, taking into account that the class 2 compression stockings and therapy we're currently discussing equals degradation in pressure from 32 to 22 millimeters of mercury. Next. If we see the data, we'll see a lot of data with rather variant importance and significance. For example, Pitaluga, back in 2013, admits no benefit from wearing the class 2 compression stockings beyond the first per day when it comes to pain, ecchymosis, quality of life, and of course, deep venous thrombosis. Whereas Baker in the same year confesses that compression for longer than 2 days postoperatively has no important effect. There are also other studies which demonstrate rather different duration of compression and different importance of beneficial effects. So next. Although the intentions are good, applying compression stockings after immediately superficial venous vein interventions in order to reduce inflammation, pain, bruising, bleeding, hematoma, as well as either deep or superficial vein thrombosis. The evidence derived from different randomized controlled trials give us a bit headache because they are divergent. The therapeutic interventions seem to be, at least in the recent past, to be a bit ill-defined, whereas the pressure and stiffness of the compression needs are not adequately provided. Moreover, there is a heterogeneity in referring the modality, the degree, and the duration of compression, whereas, as said before, there is an incomplete reporting in compliance to compression on behalf of the patients. Next. So, the 4 most recent and most crucial and important studies actually cited by the current European guidelines are the following. First, the BAYE randomized controlled trial randomizing endovenous laser ablation patients with either class 2 compression stockings or not. It randomized 400 patients and yielded statistical significance when it comes to reduction of pain and edema, but not bruising, induration, phlebitis, or paresthesia. And this beneficial effect seems to account strictly for the first week. So in other words, after 2 weeks, there was no statistical significance. Next, please. Another randomized controlled trial, the famous COMETA trial, randomizing either patients receiving radiofrequency ablation or laser ablation, showed also that compression therapy, compression stockings, were associated with better pain relief, but that's all, with pain only, than no compression at all. And after 1 week, paying also attention to the thing that patients seemingly most benefit by compression therapy were patients receiving also concurrent phlebectomies. Next, please. Another published study, a randomized study 2 years ago by Manchester, showed quite the contrary, that even after receiving compression therapy class 2 and having assessment of the postoperative beneficial effects with validated venous severity scores, no statistical significance was reached. Next, please. whereas another published study in the same year, 2020, the Finnish study, showed that even after applying compression class 2 therapy continuously for the first days and then predominantly during the day till week is reached, no compression was no inferior to post-operative compression. In other words, the compression has no such significant beneficial effect reducing pain and other symptomatology. But if in order to apply so, how long would that be? Next, please. A current meta-analysis published in International Journal of Surgery tried to address this duration issue when it comes to assessing beneficial effects on post-operative pain. Next. Recovery time and return back to work. And next. Post-operative complications with respect to specifically paresthesia and phlebitis. They concluded that if in order to use compression stockings, the duration should be no longer than 2 weeks, but it's definitely better than short-term application for the first 2 post-operative days. Next. So the previous European guidelines just had a small reference to the issue, to this matter, saying with class 1 that recommendation that we should wear stockings after either open or endovenous ablation. Next. However, current guidelines published this year say that although there's a definitely grade 1 recommendation for applying compression stockings for after open surgery, when it comes to endovenous laser ablation or ultrasound-guided post-therapy, post-procedural compression should be considered. That's a class 2A recommendation, but that it's not definite how long should that it be. Next. So compression therapy, does it worth it, or it's, as would Shakespeare say, much ado about nothing? Next. In order to conclude and share our conclusions as well as our personal opinion and recommendation, class 2 stockings are suggested immediately after treatment and for 1 or 2 weeks duration. Whether it would be 1 or 2 weeks has to do with the ABI, and also if the patient will concomitantly receive open phlebectomies, and also in case of concomitant foam sclerotherapies. Thank you very much.
Thank you very much, Efstratios. Thank you very much for this overview and addressing this important issue. We